Let's talk about something that sends millions of people to the emergency room every single year: chest pain. It's one of the most common reasons we seek medical help, but honestly, it's also one of the most misunderstood. So today, we're going to decode what's really happening when it strikes.
Right off the bat, we have to get this idea of a Hollywood heart attack out of our heads. The dramatic clutching of the chest. The reality, as this guideline from the American Heart Association points out, is way broader. We're talking pressure, squeezing, even burning, and not just in your chest. It could be in your shoulder, your arm, your neck, even your jaw. Getting this right is the absolute first step to getting help when it counts.
So, here's our game plan. We'll start with what it feels like when chest pain strikes. Then, we'll go inside the ER to see how doctors think. We're going to focus on the big, life-threatening conditions they need to rule out, then talk about what happens after the emergency is over. And finally, we'll get into how you can take control of your own health.
All right, let's dive in. Picture it, the moment it happens. The symptoms can be really confusing because they're definitely not the same for everyone.
Okay, so you have that classic pressure behind the breastbone, sure. But look at the list on the right. This is where things get really important. Symptoms like being short of breath, breaking out in a sweat, or even just this sudden, overwhelming feeling of dread. Those are powerful clues that something serious is going on. You absolutely cannot ignore them.
And this is a huge takeaway. Your experience might be totally different depending on who you are. For example, women are much more likely to have those other symptoms like nausea or feeling breathless. And for people with diabetes, the picture can get even fuzzier. Sometimes the only thing they report is feeling short of breath. That's it. Recognizing these so-called atypical signs is just vital.
So here's the bottom line. With all these different ways chest pain can show up, you just can't afford to guess. If you or someone you're with feels any of these things, the first step, the only step, is to call 911, period. It is the single most important thing you can do.
Okay, you've made the call. Now let's step into the emergency department. The moment you arrive, a very specific, high-stakes process kicks into gear. Now, the #1 priority for the medical team might not be what you think. Their first job isn't to figure out exactly what is happening, it's to figure out what isn't. They need to quickly and systematically rule out the absolute worst-case scenarios, the things that could be deadly in minutes or hours.
And they do this using a rapid, structured pathway. It starts with an assessment and an EKG to look at your heart's electrical rhythm. Then comes a really important blood test for something called cardiac troponin. And finally, they use scoring systems to figure out your overall risk. It's a method to the madness, and it's all designed for speed and safety.
Now, that first major threat doctors have to rule out is ischemic heart disease. That's the big picture term for problems caused by blocked arteries, including, you guessed it, a heart attack.
Remember that blood test I mentioned? This is what they're looking for: troponin. It's a protein that your heart muscle literally leaks out when it's been damaged. The new high-sensitivity tests have been a total game changer because they can pick up tiny, tiny amounts of this protein, giving doctors a much earlier signal that there's a problem.
And this timeline just shows how incredibly fast this all happens now. With these high-sensitivity tests, they can often run a second test just 1 hour after your first one and have a really confident answer. This means way less time spent waiting and worrying, and a much faster path to either getting the right treatment or getting reassuring news. And here's the payoff for that whole process. For patients who go through this modern evaluation and are flagged as low risk, their chance of having a major cardiac event in the next month is less than 1%. I mean, that is an incredibly powerful and reassuring statistic, all thanks to this systematic approach.
But a heart attack isn't the only emergency on the checklist. Doctors also have to very quickly look for 2 other conditions that are just as time-sensitive and potentially deadly.
So first up is something called an aortic dissection. Imagine the main artery coming off your heart, the aorta, is like a hose with multiple layers. A dissection is when there's a tear in the inner layer and blood starts forcing its way between the layers. Yeah, it is every bit as serious as it sounds.
And the pain from this is often described in a very specific, very scary way. As the Mayo Clinic puts it, it's a sudden, severe pain that feels like something is tearing or ripping, often in the back between the shoulder blades. For an ER doctor, hearing that description is a massive red flag.
The other big concern is a pulmonary embolus, or PE, which is a blood clot that has traveled to the lungs. Both of these conditions, the aortic dissection and the PE, are usually found using advanced imaging, specifically a CT scan with dye, called a CTA. Sometimes a blood test called a D-dimer can also help them rule out a clot.
Okay,
So, the medical team has ruled out the big, scary, immediate emergencies. You can breathe a sigh of relief. But what happens now? The journey is definitely not over.
First, let's get some perspective. This chart is really eye-opening. While chest pain is a totally valid reason to go to the ER, the truth is less than 10% of people who show up with it are actually having what's called acute coronary syndrome, which includes heart attacks. The other 90+%? It's something else.
So once you're safely out of that emergency window, the real detective work begins, usually with your primary care doctor. They start looking for all the other possible culprits, and the list is long. It could be something as simple as a pulled muscle in your chest, or it could be digestive issues like acid reflux, or even anxiety. The key is to follow up and find the real cause to prevent another scare.
Which brings us to our final and honestly most empowering section, prevention. Because the absolute best way to handle a medical emergency is to do everything in your power to stop it from happening in the first place.
This checklist is your roadmap. It's all about clear, actionable stuff. Keeping your blood pressure, cholesterol, and blood sugar in check takes a huge load off your heart and arteries. Quitting smoking is probably the single best thing you can do for your blood vessels. A healthy diet, staying active, these are the foundations. And hey, even wearing your seatbelt is a form of prevention. These aren't just suggestions, they are powerful tools to keep you healthy.
So, we've covered the symptoms, what happens in the ER, and the path to prevention. Knowing the signs is an absolutely critical first step, but it's only the beginning. The real question is, what are you going to do with this knowledge? What's your next step to protect your health? Thanks for joining us for this explainer.